It is my absolute pleasure to introduce our final speaker. And Adrienne is loved by many. I got the opportunity to get a hug from Adrienne when she came in this evening. And you know how some people have this genuine hug? Adrienne's hug is genuine. So her patients are really, really lucky. I could feel it. I'm like, can I have another one of those? So if you get the chance, you should get a hug from Adrienne. They might be standing in line. So Adrienne Castillo is a family nurse practitioner at the Rush Multiple Sclerosis Center with over 36 years of neuro nursing experience. She is certified as a lifestyle medicine practitioner and heads the Rush Brain Health Clinic. Adrienne thrives in a space where prescribing naps is normal and usual. See, there you go. There's your restorative, and you could do that in a restorative yoga pose. She is passionate about helping people living with MS make necessary lifestyle changes that facilitate best outcomes. In her spare time, Adrienne enjoys practicing a healthy lifestyle. She spends a lot of free time with her 10-year-old granddaughter, Luna, and hopes to role model how to achieve a balanced and healthy lifestyle. So without further ado, now, for those of you online, we will put the handout online from Adrienne, and those of you in person have a handout that you can take with you, but not look at now because you're going to listen to Adrienne.
Hello, everybody. It's so great to be here with you tonight. I'm very honored. I have to say, this is a very interactive group asking a lot of questions. So guess what? Get ready, because now it's my turn to ask all of you some questions. And we're going to start out. Mindy passed out my handout, and one of the sheets, the top sheet, was about the MIND diet, foods to eat, and then on the back side, foods to avoid. So who can give me a couple of examples from tonight's meal? What foods are compliant with the MIND diet? Just raise your hand. Over here was the fruit. Definitely the fruit. Yes. The vegetables. I saw asparagus, right? Anything else? Salmon. Excellent. Look, you guys are already so knowledgeable about the MIND diet. Yes. The protein, very good. We always want to make sure that the protein is a lean poultry, and keep that serving size to 4 ounces, which is about the size of your hand. So keep the handout out, because we're going to do a lifestyle assessment. I told you I'm going to be asking a lot of questions, and you might want to write down your score for each pillar on, like, maybe the back of it if you have a pen or pencil. I'm already not even using my slides. Okay, so we're talking tonight about lifestyle medicine in practice, assessment, and the 6 pillars. Managing lifestyle in MS matters. The Dr. Miravalli, Dr. Tom Holland definitely touched base on that, but I'll just reiterate why it matters. Reduces symptom severity, improves daily function and quality of life, helps slow progression and reduce relapse frequency, supports mental health, and it builds stress resilience, and mitigates comorbidity risk for other diseases such as hypertension and diabetes. And why does managing your lifestyle and brain health matter? Well, your brain is highly metabolic. It needs a steady flow of great nutrients and restorative sleep, exercise. Lifestyle affects blood flow, inflammation, and neuroplasticity, which is something that Dr. Miravalli touched on. And remember, Dr. Holland talked to us about how your risk of dementia can be lowered when you live a healthy lifestyle, up to 40%. All right, I always tell my patients in my brain health clinic, which, by the way, has been going strong for about 2.5 years, and I've seen 300 patients one-to-one, creating individualized treatment plans, which include making SMART goals and figuring out with each visit how to tweak that treatment plan according to individual needs, barriers, things like that. But so I always tell my patients that you cannot manage something that you don't measure, which is why we do the lifestyle assessment. And this is what I practice every day, and I'm very passionate about it. And it's just, I feel like I've reinvented myself in my career after 36 years of being what you would say was a traditional nurse. And now I get to talk wellness to patients all day long. How refreshing is that? So anyway, I do practice lifestyle medicine, and it's a specialized area of medicine in which lifestyle interventions are prescribed. That's why I said I enjoy prescribing naps, because I do like people taking naps. It is used at the Rush MS Center within the patient care model as an adjunctive treatment for MS, meaning that in addition to maybe your prescribed medication that treats your MS. It's built on 6 key pillars, and it is supported by the American College of Lifestyle Medicine, which means all the guidelines that are used are evidence-based, supported by research. What are the 6 pillars of lifestyle medicine? Number 1, nutrition. 2, exercise and physical activity. Those are 2 different things. Physical activity is more natural movement. Yes, sir. Pardon me? Yes, conditioning. Very good. That salmon's working. Number 3, sleep. 4, stress management / mental health. 5, social connection and sense of purpose. And 6, avoidance of risky substances. Okay, here we go. We're going to do a lifestyle assessment. If you have a piece of paper and a pen or paper, go right ahead, take that out right now. So what we're going to do is we're going to rate each pillar from 1 to 5. 1 is poor, 5 is optimal. I'll ask more than one question for each pillar, so consider the overall score for each pillar and consider your last 2 weeks of life when scoring each of the pillars. Okay, so 1 to 5, 1 is poor, 5 is optimal. Okay, let's start with the first pillar, nutrition. Are you eating more whole foods and less processed food? Have you had at least 3 or more servings of vegetables and fruits daily? Have you had no more than 1 sweetened drink per week? So think about your last 2 weeks. 1 is poor, 5 is optimal. 3 is somewhere in the middle. I'll give you a couple minutes here. Or seconds. Okay, for exercise/physical activity. Have you exercised at a moderate, intense way for greater or equal to 150 minutes in a week, which is 30 minutes 5 times a week? Or could be broken up any way you want. And did you add 2 days of resistance exercises? 5 is optimal, 1 is poor, 3 is somewhere in the middle. Moving on to sleep. Have you averaged 7 to 9 hours per night? Do your daytime naps last no longer than 20 minutes? Stress management and mental health. Do you have a go-to stress management technique that you practice consistently? Do you talk to your healthcare provider about your mood, anxiety, or depression, or any other mental health concern? Moving on to purpose and connection. Do you have daily support? Do you have healthy relationships? Does your life have a sense of purpose? Are you engaged in a spiritual practice? Have you spent time in nature? And last, risky substances. Do you avoid alcohol, nicotine, and recreational drugs? And this includes smoking, vaping, e-cigarettes. Yes. Okay, you just hold on. Uh-oh. 1 sip. He wants to finish it, so it's 1 drink. Okay, so obviously if you scored 4 to 5s, that's more in the optimal range. You're doing very well, living a healthy lifestyle, maybe have some areas to improve. If you're more in the middle, then there's a little bit more to improve. And then 1 to 2s, there's a lot to improve. So let me move on.
What should be the total range? That's the best range.
5 is optimal. So if you scored 5 on each of the pillars, you would end up with a 30. So just by the way, this isn't the exact assessment that I do in my brain health clinic, but I modified it for the sake of this event, but it's pretty close. All right, let's talk about Pillar 1 nutrition. What are the guidelines? The guidelines say to adopt a brain healthy eating plan. Eat more whole foods that are nutrient dense, not calorie dense, but nutrient dense. Make sure it's an anti-inflammatory eating plan. Avoid processed foods, added sugar, and saturated fats. Remember, empty calories lead to weight gain and fatigue. And added sugar, there is a limit per day. So 25 grams for women, 37 grams for men. I can tell you right now that a can of Coke has about 39 grams of sugar in it. And what are the brain benefits of following the guidelines for nutrition? You're going to improve blood flow, reduce inflammation. You're going to support that gut-brain axis that Dr. Holland talked about. And it's going to support your cognitive abilities. Now, here's some of the nutrition interventions that I prescribe in my brain health clinic, and it mostly revolves around following the MIND diet. It's a high-fiber diet because it's filled with fruits, vegetables, whole grains, beans, and if I also wanted to point out on that handout on the MIND diet, it's a nice sheet to put up on your refrigerator. Use it as a reference. But on the back side of it, foods to avoid. I think we could have identified a few foods to avoid from the meal tonight, but it's okay. We're starting fresh tomorrow. Remember to stay hydrated. We water our grass. Why not water ourselves? And ensure that your B12 and vitamin D are adequate. And you can ask your healthcare provider to check those levels. Moving on to pillar number 2, exercise and physical activity. I think you know the guidelines from the question, which is strive to get up to 150 minutes of moderate, intense exercise per week and include 2 days of resistance training. Does anyone know what resistance training, an example of resistance training? Lifting weights, yes. The resistance bands, doing squats. And the brain benefits are improves cognition and enhances mood. And then in regards to the benefits of exercise in MS, decreases inflammation, improves balance, improves fatigue. And some of the interventions that are prescribed in my brain health clinic include walking, biking, swimming, dancing, chores. Doing your daily chores count towards physical activity. Do wheelchair exercises, and make sure to count your physical therapy into the minutes per week. Add balance and coordination work. Why not? It will improve things. And make sure, and Mindy said this too, incorporate movement breaks. If you have kind of a sedentary life, here's where you start. You start standing every hour for a few minutes and just get those muscles moving and the blood flowing. And that's where you start on your health journey in regards to exercise. And that's what I love about my brain health clinic, is that I can meet patients where they're at. And this includes discussing any barrier that we work on removing those barriers and starting to make small changes. Okay, our next pillar, which is sleep. The guidelines from the American College of Lifestyle Medicine say 7 to 9 hours nightly. And what happens during those 7 to 9 hours? Your memories are consolidated. Brain waste is cleared and mood gets regulated. Your family will thank you for getting 7 to 9 hours of sleep. So a lot of my I don't want the laser. My sleep interventions focus on sleep prep and sleep environment. And I know sleep prep, what the heck is that? Well, we should put some thought into sleep prep because it does matter and make a difference in terms of helping you to have a relaxed body, relaxed enough to be able to fall asleep. And that's the goal of sleep, right? Is to fall asleep. So have a consistent sleep and wake time. Limit your alcohol, nicotine, caffeine, and screens before bedtime. At least 90 minutes prior to when you want to go to bed, put the screens down. The light that's emitted from screens prevents melatonin from being released because your brain thinks it's daytime due to the light. And melatonin is that natural sleep hormone that you need to feel sleepy and fall asleep. Remember, a cool, dark, quiet sleep environment matters. Cool meaning 60 to 67 degree temperature is optimal. Get some dark shades and curtains so that it's completely black, and make sure that it's a quiet sleep environment. Some patients that I work with like to have a little meditative sort of music on throughout the night. You know, that's how they fall asleep. And once again, it's my practice to meet my patients where they're at. And if we could ever make improvements from there, then we will. And we will work on that. And then for chronic sleep disorders such as insomnia or sleep apnea, I'll definitely send you to the sleep medicine doctor where you can get a sleep study. Okay, pillar 4, which is stress management and mental health. The guideline for that is to build stress resilience, which is being able to adapt, and this decreases the risk for chronic stress, which causes all that inflammation to begin with. The brain benefits of being able to manage your stress is that it lowers cortisol, which is a daytime stress hormone. It doesn't belong in our bodies 24 hours a day. It's mostly released during the daytime. Reduces inflammation, improves focus, decision-making, and information processing, those executive functions that we all need. And then stress management interventions for building stress resilience. In my clinic, I often ask patients to have a practice of gratitude. So 5-10 minutes every day, maybe at night as part of your bedtime routine. Write down what you're thankful for. Your brain reward system is activated, and your perspective over practicing this gratitude gets shifted from the negative to the positive. Practice meditation. Often patients say, I'm not into meditation, I can't do it, it's hard. Well, you have to practice it for at least 6 weeks consistently every night, but the benefit of it is that it puts your body into a relaxed state so that you can fall asleep. And so what I often suggest is to get a guided meditation where someone is telling you what to do next. And then you don't have to just sit there in silence and say Om. Find a go-to stress management technique so that when you become anxious or nervous in the moment, you can do it without anyone noticing it, but it helps your inner body to feel calm. So the best thing to do is some breathing technique. I often suggest the Inhale for 4 seconds, exhale for 6 seconds, and do this for 3 deep breaths. And that automatically sends signals to the brain. Your heart rate is reduced. The brain no longer perceives a threat. You're in parasympathetic mode and feeling nice and calm. And just if it doesn't help in 3 deep breaths, then do 3 more until you're feeling much better. But I think everyone here can say taking a deep breath really feels good. Nurture a positive view of yourself. So what does that mean? I ask my patients to talk to themselves as if they are talking to their best friend. What would you tell your best friend if they felt like you did? Treat problematic circumstances as if they're learning, as a learning process. Have an opportunity to learn even from problems. Practice acceptance. And once again, enjoy nature. Winter's coming. Bring nature indoors. Maybe go get some plants that you can take care of. Create a space that feels like you're in nature. And otherwise, in good weather, when it's more comfortable to be outside, get out there every day. Pillar 5, social connection and sense of purpose. The guideline is to enhance social connections and decrease loneliness. Loneliness increases the dementia risk. Social connection is as important to a person's vitality as food, shelter, and safety. And the brain benefits of social connection and sense of purpose, it boosts your stress resilience, releases oxytocin, which is considered the love hormone that you get from Adrienne's hugs. Instead of Q&A, maybe we'll just hug it out. Promotes emotional and physical well-being. I like that emoji that I just saw. Someone online did that. And social connection interventions. I love the first one because sometimes all it takes is awareness to know that there needs to be a change. So be aware that loneliness, feeling lonely, is a signal that something needs to change. And this too is an area to talk to your healthcare provider about, because certainly feeling lonely, if it's for more than, a little short-term time, is certainly going to impact your mood. And it's important for your healthcare provider, whether it's your primary care, your nurse practitioner, your neurologist, let them know. Build and maintain your relationships. Volunteer. Enjoy nature and other spiritual practices. Consider getting a pet. Pet therapy is real. Take a class, learn something new, and join an in-person or online support group. So what I want to say about that, about support groups, is support groups need to be uplifting, not depressing and sad. So it is perfectly normal that it might take you 3 attempts before you find the right support group. There's plenty of out there. I just got 2 cards on different support groups from a table over there. Find your tribe of people that you feel connected with, that will uplift you And don't worry about the ones that you didn't feel connected with. Last but not least, Pillar 6, avoidance of risky substances. So the guidelines are to avoid tobacco and recreational drugs. So in other words, if you don't smoke or do drugs, don't start. Limit your alcohol, less than 1 or equal to 1 drink per day for women and 2 drinks per day for men. And remember that long-term use of benzodiazepines, used often for anxiety, worsens anxiety. And these should be used in a very sparing way, especially maybe just appropriate for MRI sedation. And examples of that category of drugs, Xanax, Ativan, Valium. And the brain benefits of avoiding risky substances includes decreased risk for cognitive impairment. So finally, my summary and my call to action. You know, your brain is the most vital organ, and I can say that because there's not any cardiologists here. But I will tell you that what's good for the heart is good for the brain, and what's good for the brain is also good for the heart. Brain health is definitely influenced by lifestyle choices, and that is why it's important to have a brain healthy life. Make small, consistent changes. Improve by 1% every day. Imagine the impact after 30 days if you follow that. This is not about perfection. It's the smaller the change, the more sustainable it is. And we're interested in making intentions grow into habits that grow into a lifestyle. Every time you eat, move, or rest, you're shaping your brain's future in one way or the other. Thank you so much for your attention. I really appreciate this opportunity. Thank you, Mindy, for allowing me to speak. I love what I do. I hope it came through in what I talked about. It's one of the most rewarding careers that I've ever had. And what a way to finish out my career at Rush is in this role. So Dr. Miravalli, please keep me. I need my job.
Wonderful job, Adrienne. Thank you. Does anyone have any questions for Adrienne?
Hi, we love you. So when she was talking about support groups, I just want to share an amazing support group that I found. It's called Modified by MS. On Mondays, they have 2 separate groups. They have a men's one that is run by a man living with MS. And then they have a women's one also run by a woman with MS. On Tuesdays, they have a co-ed one. I found it this summer, and it is a positive, uplifting, supportive place. It's called Modified by MS. I think it's .org. Just wanted to pass it along to everyone. But my question for you is, we were talking about sleep as a huge pillar. What if we have a very easy time falling asleep, but we wake up and we're up from like 2 o'clock to 7 o'clock? How do we fix that? Because that's a huge pillar and it sucks.
Right. So that's something that we definitely work on in the Brain Health Center. If after 20 minutes of being awake, you cannot get back to sleep, move out of your bedroom temporarily and go into another room and do something that's maybe boring, like reading. And because the whole object, well, I don't mean that reading is boring. Choose a boring content. So on the Calm app, there's bedtime stories that you could actually listen to, and the content is mundane. The whole purpose of that is to get your body relaxed so that you have the ability to fall back to sleep. I had a patient share a recommendation with me, and that's to whether you're trying to fall asleep or go back to sleep after waking up, count to 150, and you might find yourself with your mind wandering off and thinking about something else, and then you're going to say, oh, wait, I was counting. So go back to where you left off and try again. Keep doing that until you fall asleep. So, of course, I had to try that, and it does work. Is it 100%? No, but it is a strategy.
All right, I have another question from online. My neurologist told me not to take B12 vitamins. Why is B12 controversial or not agreed upon?
I'm not sure the specific reason for that individual. However, if your B12 level was high, maybe it was to get the level back down to normal. I honestly, as long as you're eating healthy, it is the most efficient way to get all your nutrients from the diet, from your food. And we don't even know from supplements what gets absorbed. So I think it was Dr. Holland who said there's some expensive pee in the morning. But so the first step in regards to B12 is eating sources of food that contain B12.
Okay, so my question is, you under the pillar of sleep, getting 7 to 9 hours, the benefit is the memories are consolidated.
Memory organization occurs during sleep.
Okay, so if somebody consistently gets 6 hours of sleep for 3 months, can they ever get those memories back or ever get those memories organized again? Or is it just brain fog forever? Like,
Yeah. Yeah, I understand what you're asking, and I'm not sure I know how to answer that, so I might need help from my team. Oh, good.
Yeah, so the memory consolidation piece is the memories during the day, the experiences that you live during that day. At night, that's when you consolidate those memories into a long-lasting forming memory, right? So if you sleep 6 hours, it's going to be fine. But I think this recommendation has to do with consistently and uninterrupted sleep. That's actually when you get the benefit. If you're at 6 hours, try to do something to bring it up to 7 to 9 hours. Interestingly, studies looking at more than 9 hours is not better. So there is a limit, is the ceiling effect, right? So don't go beyond 9 hours, don't go below 7.
And I did forget to explain about the 20-minute nap. Everyone was disappointed in that recommendation from me. I got you all worked up, saying that I do prescribe naps, but they are 20 minutes. And it's just so that you don't fall into that deep sleep and then it gets interrupted. And if you've ever woken up from a nap and you feel more tired than when you went down for the nap, that's called sleep inertia. And the purpose of a nap is to refresh you enough so that you can tackle what you have to do the rest of the day. It's not to catch up on sleep or anything like that. So also the 20-minute nap makes sure that you're not going to interfere with nighttime sleep. So you need to be tired in order to fall asleep, And a nap may just prolong you from going to bed at the same time every night.
So you were talking about things to avoid, like medications to avoid, of like, so yesterday I went to a spine doctor and they were saying you should start low dose naltrexone. I've never heard of that. Either, I don't know if you or Dr. Miravalle wants to touch on that, but is that a medication that we want to stay away from? And why are they pushing to prescribe? I've never heard of it till yesterday.
What I know, and I'll ask Dr. Miravalle to address this further, what I know about low-dose naltrexone is that it's for an anti-inflammatory effect, and that there's not too much evidence behind it.
I agree. I don't think I have anything else to add. Is that no scientific evidence that low-dose naltrexone helps in multiple sclerosis. And actually, there was quite a lot of research done. There was a lot of effort. At some point, LDN became kind of like that popular intervention that a lot of individuals wanted to know more about. And consistently, the research fell short in showing any measurable benefit of taking LDN.
Thank you very much for this opportunity. And I hope you'll take the first step to your new health journey starting tomorrow.